Microphone. Cornelia. No.
Hello?
Cornelia, we're just taking a photo of the panelists, so just look up. Thank you.
Welcome to our session, everyone. Nice to see all of you here. My name is Walter Flores. I'm a research professor at the Accountability Research Center, American University here in Washington, D.C. So our panel will be at the heart of the discussion of domestic resource mobilization, which, as we understand and we know, is very critical at this moment in the context that we are living of less international support and the importance and the relevance of national countries playing a greater role in terms of mobilizing domestic resources. Domestic resource mobilization can be understood generally in the narrow sense and the broader sense. In the narrow sense, is usually understood like doing advocacy and work to request, to demand a higher resource allocation from governments. That is a narrow understanding because this is assuming that the government has the funding. It's only that they decide to use it elsewhere, which in many cases that's not the situation. The broader understanding of domestic resource mobilization is understanding the capacity of governments to increase public resources either through taxation or through fair trade and investments. And this is much relevant for our work because it's related to fiscal policies. And all of us in civil society, it's very important for us to understand about fiscal policies, how do they work, and also what kind of effects may have some regressive fiscal policies. For instance, many of our countries, how they raise the funds is through a value-added tax to whatever we buy. And that, as we know through all the research, is one of the most regressive taxes. The poor people is higher affected by the net impact of taxes. So if we are not aware of fiscal policy, we may be supporting some government reforms to increase taxation through value-added tax, which in the end, it may have a more of a negative impact into the people we are trying to serve through healthcare service in terms of reducing their purchase power. They won't be able to buy food. They wouldn't be able to buy other essential needs. So that's why that we need to understand how relevant is the fiscal policies and what kind of taxation may be progressive, which one will be regressive for people that are in greater need. So we're going to be discussing all about this in our session, in which what we're trying to explore is how civil society organizations, as the one that we have here, have engaged with domestic resource mobilization for maternal and child health mortality, combating malnutrition, and improving women's reproductive health outcomes and influencing national policy through coalitions, but also centering the needs of underrepresented groups in decision-making. Okay, so that's what we're looking into our panel. For that, I'm going to present the panelists. First, we have a virtual presentation of Cornelia Assi Nwue. She's the executive director of Samasha Medical Foundation. Cornelia is a public health leader with over a decade of experience advancing accountability and governance in health systems across the global south. As the executive director of Samasha in Uganda, she leads initiatives that strengthen policy, financing, and citizen participation in reproductive, maternal, newborn, child, and adolescent health. Cornelia, as I say, is going to be presenting virtually. We also have Christina Chilimba. She's the founder and chair of All for Youth. Christina is from Malawi. She worked for this youth-led organization and coalition advancing gender equality and domestic investment in sexual and reproductive health. And also as the co-chair of Global Youth Platform, she ensures young people influence in health policy and decision-making. In Malawi, Christina has supported the mobilization of youth groups to advocate for inclusive budgets and government accountability. Okay? We also have Diwa Saman. Diwa is the chief of staff at the GFF Secretariat. She's a health economist within the Global Financial Facility here at the World Bank. Diwa has an extensive experience working with the government and international organizations. Before joining the GFF, she worked as a senior health system specialist at the Global Fund in Geneva and provided technical support to many countries in terms of governance and financing. Before those roles, Diwa was working for the government in Afghanistan, including as a deputy minister of health. Finally, we're going to have Mustafa Kudrati. He's the senior vice president at PAI. Mustafa is an international health and development executive with more than 30 years of experience driving strategy, innovation, and accountability in global health. His expertise spans integrated health programming, organizational leadership, and rights-based advocacy for sexual and reproductive health and justice. At PAI, Mustafa leads the international advocacy practice area with a focus on strengthening accountability for domestic commitments to reproductive health and rights. Okay, great. So we have going to have a great panel, and our intention is to keep it brief so we have conversation with you, so we can have sufficient questions from you, because we want it to be this a dialogue among what would be the strategies that we can use for this domestic resource mobilization. Okay? So with that, we go to our first panelist. Please, Cornelia, so we have ready for Cornelia to present. Cornelia?
Cornelia, we're ready to have you present. So. Can you hear us?
Yes, I can. Thank you. Good morning, good afternoon, good evening. We're delighted to be here to share and discuss on the role of civil society. And I would like to start by applauding us by saying that over the years, we have made very great strides in improving and achieving the targets, focusing on the women and maternal and child mortalities. But we know that we continue to have a bit of gaps with reaching and improving on these outcomes, these health outcomes. Our governments have pledged a lot. They have given us the political will. They have shown what needs to be done. We have developed the policies, but this progress is far from enough. I think we need to do more. But this calls for stronger accountability systems. It calls for stronger collaboration, working together with the different partners and saying, how can we be able to harness this? Over time, we know that we have made a number of commitments at different levels, just by our governments, but also at the regional fora, like the East African Community, at a forum like the NIAPACO, the East African Reproductive Health Network, at the Ouagadougou Partnership, and even we have global initiatives like the FP 2020, FP 2030, looking at family planning, the Every Woman, Every Child movement, global strategy, and now the most recent Every Woman, Every Newborn, Everywhere, the EWNF. But these commitments we have seen, we continue to still struggle with them, having them translated into local action. And local action means that how can we be able to have them come down and they're centered by the communities, looking at the communities they want to serve. And with these gaps, we have seen that we still have challenges. While we allocate resources and the money is allocated, oftentimes we have seen challenges that it is not disbursed, or the delays in disbursements, expenditures are even made worse. And then we also see that the data that we get from this is often fragmented. And this in turn creates an accountability gap. And for us to be able to address it, it is important for us to see how can we leverage and reduce that gap between the promises that we are making and the actual delivery of these promises that we have made. But this calls for collaboration, this calls for us working together, and this calls for transparency and steering on with evidence-based dialogue. And what have we done as Samasha in Uganda? We thought that we cannot have accountability without having trust. And trust is the coreness of this discussion that we're talking about. And what does this mean? We have a number of independent CSO platforms and mechanisms. And today I'm here to share about the motion tracker approach that helps us to translate these global commitments into local action, where we are able to bring the civil society to foster that conversation, to see how can we have honest dialogues on the progress that is being made. What are the barriers? How can we be able to discuss the barriers and be able to come up with solutions around them? And we saw that from experience over the last 6 years, where we've used this accountability mechanism in 17 countries in the global south, from the Francophone West Africa to some countries like Kenya, Uganda, Zambia, Tanzania, and even Indonesia in Asia. We want to see that we have been able to steer some of these conversations. When we had the FP 2020 commitments and that movement, there was very minimal civil society participation. But we were able to sit and say, we cannot translate these commitments. And it was important for us to say, what do they actually mean? What do we need to do? Can we help? Because we have seen that these commitments are often made by very small partners, siloed sections. And yet when we want to achieve them, it calls for us working together and saying this is what needs to be done. So in countries, we were able to get meaningful participation and engagement with civil society, helping them to, one, understand what these commitments are, what do they mean, so that we remove the conversation from us pointing our fingers and blaming government and saying we are not doing more, we expect more, but we're also saying, can we work together? What is our contribution? How do we also support this process for us to achieve this commitment? And we see that in Uganda, where the government made a commitment to allocate about $5 million for the procurement of reproductive health commodities, including family planning, that with civil society efforts, we're able to increase this amount from 8 billion shillings, which is about $2.3 million in the financial year 2017-2018, to now about $6.8 million as of 2023-24, because of us saying this is how much money that we need, and this is how it fits the need for family planning commodities. Has this helped us get where we're going? Yes, but can we do better? Much more. And this means that it is important for us to continue leveraging on the power of trust and saying that as government is being willing to share information, is being available to share this information and able to respond to the voices of the citizens, that even us as civil society, we take the onus to come in and say, what is our role? We come in and say, how do we use the data? How can we translate it into meaningful conversations? What is easily relatable by our decision makers and our policy makers? And also, how can we be able to continue amplifying the voices of the communities that we serve? What we have learned from this is that we have been able to navigate this, and this has been able to be steered up to FP 2030 in the commitments, where we saw very active participation of civil society in the commitment-making processes within the different countries, for them to come and say, when we make a commitment and say we want to allocate 5 million, why 5 million shillings? Why not 6? Why not 3 million? Where are we going to get this from? And what do we need to do better? And then we have also seen that this has also helped us to galvanize action at the subnational level. And we have seen in some African countries that it has gone below to see that implementation through the family planning costed implementation plans that have been domesticated in some districts and in some states. And what we have also seen that with these conversations, it has been translated to go beyond just family planning, but we have also learned on how to be able to amplify this messaging for the Every Woman, Every Child global strategy. And now we're also trying to look at it from the maternal and newborn health acceleration plans. There's still a lot that needs to be done, but with us coming together and saying that we are not pointing fingers, we need to be able to have this conversation and we're able to have this dialogue. We think that with this, we'll be able to achieve these commitments. They'll be translated because we have a shared purpose and we'll be able to know what actually needs to be done working in unison. Thank you very much. Back to you, Walter.
Great. Thanks a lot, Cornelia. That was a great presentation of very concrete examples of how a civil society coalition has been able to increase the allocation of resources for for commodities and other very relevant services. So thank you. That's a very great example with a lot of success. Now we go to our second panelist.
Yeah. Good morning, good afternoon, and good evening to all of you, wherever you are. Thank you so much, Walter, for leading that back to me. And thank you, Cornelia, for breaking the ground with all that information. You've kind of shortened my inputs there, which is a good thing. It means that we are aligning and speaking to the same thing here. Again, I think I'll touch on just young people, at the same time youth-led organizations. At the same time, I think as I speak, it will be regarding exclusions in all areas. I think for young people right now, just across the continent of Africa, and I think it's around the world, more than half of the population is young people. And we find that most of the times when it comes to decision-making platforms or issues where we're talking about policy development, these young people are not there. And that's a huge chunk of the population that we're leaving out. And as Walter rightly started with the conversation, most governments right now are looking at how can they increase revenue because, I mean, donor funding is dwindling, right? And we get to see that obviously most of it is going to be tax increase, whether be it on income, on consumption, all that is increasing. And it's us youth who are going to fund those programs because being a huge population, I mean, it's simple math. If we're higher, like if we're a big population, then we are the ones who are going to be incurring that cost of taxes to fund these programs. And so when you get to that understanding, you start to realize that this is not a conversation about giving us space. It's not a conversation about rights policy. This is a fiscal imperative. And I think it's something that we all need to take in mind and realize that young people are not just people you bring on board. It's a necessity. It's for your own good because at the end of the day, we are the same people who are going to implement those programs. And I think seeing how the development space, how the world is changing, we need to start doing things differently. As Cornelia said, we have a lot of platforms. We have a lot of programs. We have a lot of policies that have been made, including the Global Financing Facility, having so many countries develop their investment cases. There's no problem there. We have aligned our priorities. The issue here is where are the resources going? So when we have these investment cases, yes, the country has developed well-defined programs and plans. How is the funding coming in? Where is that funding going? What's being prioritized in those conversations? And I'm sad to tell you the truth, we are not there as young people. And so we don't know. We have no voice. We just find out, okay, from the investment case, this is what you came up with, but this is what we're going to fund. And every time we ask question is, well, we don't have enough resources. Well, it's high time we do things differently, not just for necessity, but for the betterment of the future, because it's a shared future. I'd like to say this, that for whatever programs that we are doing right now as young people, we are shared. We're not just stakeholders, let me put it that way. We are shareholders of the future, right? And so the problems that we're going to face with the programs, the systems, if they fail, it will be us to incur that cost. If they're successful, oh, well and good, it will be for the betterment of all of us. And I think that needs to be a reality for not just program planning, but implementation itself. So I feel like at this point, moving forward in our planning, in our implementation, focus needs to be more on the budget and allocation. Where is the money going? Accountability is key. And we see that with dwindling funding, a lot of coalitions might be facing a lot of problems. There's no funding. For people to meet and build advocacy, there's need for funding. There's need for money for people to, continue their work. As a youth-led founder of a youth-led organization, there's a lot of problems when it comes to young people and pushing initiatives. We have seen over time, and I won't repeat it because this is like the third, the fourth day of this conference, annual meetings of the World Bank. And I think you've heard this over and over and over again. But as young people, we're able to make so much impact with little less, right? But at the same time, we are the ones that are given short-term funding. So as a youth-led organization, you give me $70,000 to implement an activity in 1 year across the country. That is just not in one district, it's across the country. I'm leading coalitions of over 40 youth-led organizations on that amount alone. Now, the very first phase of the year, I am building advocacy, meeting with Parliamentarian Caucus on Health. I am meeting stakeholders, CSOs, trying to make our voices heard. We have built momentum, we're recognized by the government. My very own minister really makes sure that we're in the space. Then there comes the next year, we have no funding. I am supposed to pull youth leaders in the space, make sure that they're still engaging, young people who are taking it out of their way, apart from their own life, their own building of career, advocacy, which is a passion for them because they would like to give back to their communities with no funding. And then the question comes, you're not being effective. You're not performing. We can't see you on the ground. Where are you? What are you doing? And then little by little, you're excluded from the platforms. You're excluded from invitations. That's exclusion from impact. I think it has to become a reality of understanding to say, as we are engaging young people, are we really making our policies to be youth-centric? Are they really building up the population that's coming before us in a way that they will actually understand the systems? They will not go back to step one of advocacy again, step one of trying to understand what are the gaps. We keep going and repeating the same reports that we've had over and over without learning from the gaps and the issues that are there. So I think it's a way of trying to do things differently, not as the way we used to do them before. And I think it's a call to all of us to say we need one take from the conference that we have here today is how are you going to do things differently? You look at your programs and assess them holistically. It's no longer a matter of I have done a report, we have implemented what we have said we were going to do. It's about, is that really heading towards the result that we want? If A is not equaling, if A plus B is not giving you C, it's high time to do A plus B equals C. Things differently, rearranging them, re-strategizing, and making sure that young people are co-designers, co-facilitators, co-implementers, and are in the decision-making space. Thank you.
Thanks a lot, Christina. That was very eloquent and very powerful. Something that I was thinking while you were presenting is, which is a question that I will leave it for you so we can talk about later, is that what kind of coalitions you as a youth representative would be expecting that can work with you as a youth for capacity building and mentorship so you can actually have what you need as skills and knowledge when you eventually take over the decision and policy-making roles, because all the youth are going to take those roles eventually. Yeah. So instead of just waiting to reach that level, how can we start building coalitions that from now onward is supporting you for that?
Can I go right ahead, Walter?
Okay, go ahead.
I was ready for you. I think I'll share about 3 effective strategies that we have seen that have been working, and most of them are coming under the Global Financing Facility. Like I said, as apart from just being a founder of a youth-led organization, I'm also right now currently acting co-chair of the Global Youth Platform. And one of the coalitions that we have, we call it Civil Society Coordinating Group. It's a cross-generational coalition. So you have CSOs and youth-led organization coming together, building advocacy agendas together across countries and across continents. I think making sure that we sustain those platforms is very key because they are the backbone of what happens on the ground. The grassroots voices are pointed out and magnified in such platforms. And therefore, at a time such as this, where accountability matters more, we cannot afford to let go of such structures. The other one is building data-driven evidence among coalitions, among youth-led organizations. This is what creates credibility for civil society and youth-led organizations, be it at a subnational level, national, and a global level. And that means making sure that young people are in the space. They are being trained. They are part and parcel of every improvement when it comes to training in a new system that is happening at a ground, whether subnational or national level. Again, global alliances are very key. I think as trends are changing, we cannot afford to lose out on global alliances and the impact that they play. Because as we're moving, it's easy to look at the changes that we need to make and forget the successes that we've had. And I think this is a time to move in one direction, but not forgetting any other space, no exclusion whatsoever, but looking at the lessons that we have and the successes that we have. How can we scale up the successes, and how can we build the lessons into those successes to ensure we're not missing out on anything?
Great. Thanks a lot. Great answer. We're going to continue with the questions later on, but now we're going to hear from Mustafa.
Great, thanks, Walter. And it's really hard. Walter, Cornelia, and Christina are hard acts to follow, okay? But I think what we wanted to share from a PAI perspective is these are not normal times. And I think for the last 10 months, 11 months, we've been going around telling each other these are really unusual, different times. So what I'd like to focus a little bit on is what have we learned from the work that PAI has done in the past with partners around throughout Sub-Saharan Africa, and then what do we need to learn more in order to be effective in these unusual times as well. So I think that two things I want to share, and with Cornelia and Samasha, PAI has done budget advocacy work for almost 2 decades now, and we've been working with local partners, local organizations, to move the dial on budget advocacy. And what did we learn? Okay, what have we learned? And we've learned through one particular framework that we'll share called the Common Framework that Samasha was part of developing as well, along with several other organizations, it is really, really, really critical to follow the money. Okay, I think that if you want to learn about budget advocacy, it's about follow the money, follow the money, follow the money. Too often, civil society organizations are very satisfied when we hear that we managed to advocate during the budget approval process and managed to get the money in. So good examples even in these unusual times. In East Africa, the 3 core East African governments, Uganda, Kenya, and Tanzania, mobilized $500 million in their 2025-2026 budgets for health. They mobilized an extra $500 million that no one thought was possible. The question comes, and Cornelia is very familiar with this, that those promises get made. Does the money actually show up? Right. Does it show up on time? Does it come through? So it's really, really critical to follow the budgets, follow the money. And what we realized is that we all had different ways of doing these things, but we didn't have a common way of approaching it. So we worked with partners in multiple countries to say, what process do we put in place? What kinds of indicators do we put in place so that we're able to follow the money? Mm-hmm. And we've come up with like 6 key dimensions that we follow. And there's more detail. You'll see that we have handouts on some of the chairs, and there's a QR code that'll take you into the resources that we developed as a group. And I think the 6 dimensions are the following, right? First, establish clearly the funding need. And it was really helpful, Cornelia, you talked about the costed implementation plans that the family planning community has developed. And I think that's really, really critical. Follow the money, establish the need, because don't just say the amount of money increased. It's very, very important to know what percentage of the total need actually got funded. I think earlier this morning there was another panel on financing as well, where they say that the actual need in LMICs is $60 per capita, and yet countries are raising, I can't remember what the numbers are, but it's less than $17, okay? So $17 per capita are being raised. So that's why it's really, really important to first be clear, what is the goal that we're trying to aim for? Focus on that total per capita need per country. Don't just focus on, the money increased, it doubled or it tripled. Yes, but what's the gap? And be conscious of the gap. The second part is look at, and for us, we looked at our very sector-specific work. We've been in the reproductive health sector. You do need to pay attention to sector-specific work. We are in the middle of an unprecedented attack on women's health. Okay, let's be super clear. We're in an unprecedented attack, and if we don't follow the money, guess whose money will suffer? And whose programs will suffer? It will be women's programs. So that's why we really insist that it's really important that we follow the money, we follow the allocation of funds. Once that is done, you got to follow the disbursement. Okay, Diwa, you've been a deputy minister. You know that it's the release of funds, when they get released, what the timing is. If the funds get released from Treasury in May and your fiscal year is ending in June, there's usually a big rush to do trainings and do construction because that's all you can spend your money on, and you can't really develop programs. So look at the disbursement cycle. Look at the actual expenditure as well. Are the funds actually going and being spent the way they were intended to? And then measure the outcome again. So did this lead to an increase in services delivered? Did it result in the uptake as well? And then throughout, we learned over time to track transparency as well. And I think this is showing up in multiple studies, right? So Diwa will speak to this a little bit down the line as well, that even with GFF funding, we found that like CSOs really are engaged during the investment case development, and then post-investment case development, the amount of engagement really goes down as well. So I think that's something we want to share, very practical. We've learned over the years, we've developed it, we've strengthened it, and we need to do this. Now, what do we need to do for the future, right? Because Walter, you were bringing this up as well. And I think these times demand very, very different results. And let's be honest, I was talking to one of my colleagues yesterday that we were pretty well fed in the global health world, okay? All right, I've worked in other sectors as well, and those sectors were not well fed. They have been organized, they've been focused on the kinds of asks they're making. The global health world is waking up to how strongly we need to advocate for domestic resources as well. But in order to be effective advocates, we've got to learn both the language of financing, what goes behind the scenes. If we're talking to our colleagues at the World Bank or we're talking to someone in the Ministry of Finance, if we don't know what we mean by social impact bonds, if we don't know enough about what debt to health swaps look like, if we don't know, I mean, there's all this very specific language that we need to be familiar with. And I have heard, and I'm sure all of you have as well in the last few months, let's start imposing sin taxes. But I think, Walter, you brought up a great point there that watch out for what you ask for, because you have to look at who are you really taxing and who is it that is ending up paying for the services that you're demanding for as well. So I think that's really critical. Again, we know this, universal healthcare, and really focusing on universal healthcare and where countries are going with the rollout of their universal healthcare plans is critical. We know, for example, in family planning, that because under the MDGs and then following that under the SDGs, we got countries to commit to free services, family planning services for women. Insurance companies refuse to cover family planning services under their universal healthcare schemes. Zambia is one of the only countries that we know of, that's an exception right now, that has specifically included family planning services as a covered service under their universal healthcare scheme. So it's really, really critical. Pay attention where the universal healthcare is going. 2030 is just around the corner, and that's where we've committed to shift to a universal healthcare plan. Last 2 points. I think we need to align better with larger global advocacy initiatives. We did show up more strongly than ever before at the Financing for Development because our sector is in crisis. Okay, I'll be honest. Okay, we haven't always showed up. Health partners didn't show up during the Jubilee 2000 movement when we tried to get debts forgiven. We are showing up now. We absolutely have to show up because our sector is in crisis as well. And I think the last thing I want to share is just, I have lots of things to share, and I can bring it up as well. I think it's really important that we be coordinated. You brought it up as well. Too often we've gone in, I've talked to counterparts in the government as well, and they say, come on, you're the 7th organization that's come to me to talk about vaccinations, or you do the nth organization, can you come with a coordinated ask and a coordinated vision so that we can get a clear message about what we need to prioritize and what we don't need to? So I think as CSOs, we need to get our act together as well and be clear with the asks and not come with a list, a really, really long list, but be effective in what we're asking for as well. So more to come, but lots going on there too. Thank you.
Great. Thanks a lot, Mr. Abad. It's a really great points. I completely agree with follow the money. We have done that in Guatemala, some other countries, Latin America, but follow the money is also a very intensive effort that the closer you get where the major decision making is, the more you need specialized knowledge on public accounting and budget law. So my question, which is the same question for Cornelia, which I thought raised a question when you were talking, is that both of you present very successful examples, but that requires a lot of effort. Like in Cornelia, is fighting every year for the budget, which of course there are success, but that means that you need to be prepared for fighting every year. So my question to both of you is, what kind of strategies can you think that we can make this sustainable in the sense that if you have mobilized lots of people to follow the money for a couple of years, then it will be less people doing it because there's less need for that, because there is some sense of sustainability there. And for Cornelia as well, what kind of strategy can you imagine that you don't have to fight every year, or if you have to continue fighting with less of time or civil society or with less people so they can concentrate on something else, that you can see that this is becoming sustainable, it's not the same fight every year. So if you can share, if you have any idea what sort of strategies, or if you're trying some strategies around that.
Cornelia, you want to start? You have lots of great examples of this, so over to you first.
All right. I think one of the strategies that we have seen is in terms of, I think for us, it's trust building, because for as long as we keep competing and saying we want to start being confrontational, and that is what most times we want to do as civil society, is where we tend to lose it. So if we're able to come and have this neutral space where we can comfortably say that our governments can share the data, even the little that is coming in, because, for example, in Uganda, we're so excited every year that government would allocate the money to the allocation and say, oh, get celebrated and say, oh, yes, government is doing a very good job. Until we started asking, but is this enough? Now, instead of coming to tell government, but this money, you're not releasing it, it was about saying, maybe now it is high time we change the narrative. How do we phrase it so that it is more positive, it is more receptive, so that it even encourages the government, one, to share data, because once they're able to share it and to know that in this our objective is the same, is to see that we are reaching the communities that we want to have, we'll stop fighting. We'll start working in partnership. We'll no longer have that suspicion, and it will become easier for us to know how that relatability that we can be able to grow. But the other strategy that we have seen is institutionalizing, because once for countries like Kenya, where these independent accountability mechanisms were institutionalized, for example, Kenya by the National Council of Population and Development, thank you again, is that once they know it and say, okay, beyond what we are doing as government, it is important to see what our progress looks like from the other side of the table as well, and be able to collect these and see that it is actually coming back to the same result that we want. It makes it easier, and for us that is another strategy that has worked. But the third has been working with the power of champions. We talk universal health coverage, we talk about integration, we talk about the need to break and explain all these in the different contexts. But one of the things that we continue is that we need to make it easy. When you talk about maternal and child health, it is the medical language, it is us, the small cycles that actually know what we're talking about. But how can you be able to break it into easy to use formats, easy to read, so that when we talk about quality of access to quality care, for the communities, what does this mean? How do I be able to understand it? I'm not going to go and explain all the big commitments, or our country has said we are committing 5 million, no. But when I break it down to the community, to know that at a district level, that this is what it means, that when I go to a facility, I can be able to access these commodities X and Y, and then they'll be able to know. The citizens themselves will know that, oh, they can comfortably demand for it, and also be able to see how they can be able to support that process. And I think once we have that, it becomes easier and also strengthens and shows that whole shared ownership that we want to have. Thank you.
Thank you, Cornelia.
Walter, this is such a great question, okay? And I think it's a great question for advocacy organizations to hold dear, right? That are we repeating the same things over and over again? Not that we'll ever have to stop repeating and insisting on our issues, but how are we doing that? And what are some systemic ways in which we can really address this, right? So I think there are a few things that we've learned over time as well. I do think that costed implementation plans are really helpful exercises because it puts a real number and it's a real prioritization exercise around what it is that national governments are going to prioritize. So focus that energy on working with the government on costed implementation plans. They're intensive, but they set the scene for the next 5 years. They tend to be fairly realistic in terms of what is possible within the economies of a country and where it can move forward, right? So that's, I think, one thing. The second thing is understand the system. So I'm originally from Tanzania, and when we did budget advocacy in Tanzania, one of the things we learned is that in Tanzania, through an IDRC investment with the Swiss Tropical Institute, they established what was called a software that every local government receives to do planning for their health plans. It's called PlanRep, now in version number 3, and everybody has to enter all their priorities in PlanRep 3. Guess what? Family planning was missing when we went in and when we talked to the programmers. So we went in and we discussed with the programmers and with the correct division, which was not the reproductive child health division within the Ministry of Health. It was the policy division within the Ministry of Health. So go to a very different group of people, not your usual suspects. And we worked with them to say, how do we introduce family planning into this model? And for those of you who are public health and economy experts, they had used a DALI model, which doesn't lend itself very well, disability-adjusted life years, that doesn't lend itself well to family planning, okay? So that's why there was a fault in there. But then we went one step further and we made sure, because it's software, that it was specifically programmed that if a district programmed for no money in family planning, they could not press the submit button. And we put a minimum threshold saying you've got to put X number of dollars into your budget. Otherwise, you just can't submit it to national government for movement. So I think let's be smart. We've got to be really smart about our advocacy, but it's a systemic response that got things into the programs as well.
Right. Thank you. Great response. Thank you. Now, Dewa.
Thank you so much, and good afternoon. Honestly, the responses and the conversation so far, it was very inspiring to hear that. Like, I don't need to speak about the impact of civil society in this space. We have documented really good examples of how civil society organizations and youth-led organizations are already impacting at the country level and helping governments, keeping governments accountable, mobilizing more resources, and from GF on the setting of the scene, as you started initially too, we're at a time right now where many of you spoke to this as well, that fiscal space for health in many countries are not ideal, but also the global health financing landscape is shrinking as well. It's disruptive, but also I think it's an opportunity for all of us, whether we're at the World Bank or GFF, whether for governments or the civic sector, to take it as an opportunity for the changes that you were talking about, that is there a way that we can do things differently? And I think this is a moment of reflection on what could be done differently in this space. We've seen that over the last 2 decades, many countries, specifically low-income countries, including those that we support through the GFF, when it comes to women, children, and adolescent health programming, there is some form of dependence on aid. And intentionally, when this money is available to governments, they don't often prioritize that in the government budgets, unfortunately. There has also been fragmentation in the way the financing actors, whether global financing actors have been supporting these initiatives. There has been fragmentation, you alluded to it as well, in the civil society sector as well, where we may have missed to coordinate well. We may have missed opportunities for coalition building. So these are some of the general reflections from all sectors, from what I hear today, but also throughout these 4 days, after participating in different events, that yes, this is a moment of thinking differently. And surprisingly, it's a good time for GFF as well, because the Global Financing Facility for Women, Children, and Adolescents, it was established in 2015. So in 2025, we're marking 10 years anniversary of the GFF. For those of you that are not familiar with what Global Financing Facility is, it's a partnership that's hosted within the World Bank. It supports women, children, and adolescent health, particularly across 36 low-income countries with very high burden of maternal and child mortality. The model, the way it works, it's basically catalytic. The Global Financing Facility, it mobilizes financing, it puts modest amount of grants in, and then hopes to leverage more financing through IDA and IBRD of the World Bank, and by bringing external partners to support country plans and countries' processes. So the GFF is a country focus model that was set up in 2015, and by country, we don't only mean government, it means all country stakeholder. This word often gets misinterpreted as when we say country focus model as to only government, but that's broader than government. And in a civil society organization, since the formation of the GFF, it had a very predominant role in the establishment of GFF itself in 2015, but also at the global level as well. You mentioned the coordinating groups as well that has been guiding the GFF's work at the GFF's investor group, at the GFF governance bodies, but also at the country level. GFF supports countries, the country-based platforms, and one of the incentive structure as we engage with governments are to include a civil society or organization and youth representative in the discussion around investment cases. Now, GFF, like many other organizations over the last 10 years, it has evolved. It has continuously evolved based on the learnings from the implementation of the model at the country level. It hasn't remained static. We started with, supporting countries with RMNCH specific investment cases, to moving away from very RMNCH specific investment cases to supporting countries' national plan, but with a prioritization for RMNCH and follow-up support on resource mapping and expenditure tracking. We've done a good job on mapping resources against these costed national plans. It has been easier to do that, but obviously given the financial and data systems, the difference across countries, expenditure tracking has not been consistent in terms of our support across country. And to your point, that's a very important way to track whether the plans, the ambitious plans that we talk about actually end up getting implemented or not. So this is basically the model. It has evolved over time. In 2020, the GFF's investor group, with the support from civil society working group and other, they reflected on a GFF CSO engagement framework where they proposed a framework to institutionalize how we support a civil society organization and youth-led organizations within the GFF model. It was followed up by many other evaluations at the country level, most recently GFF's independent evaluation strategy, independent evaluation that's feeding the new GFF strategy as well, with a focus on more country presence, but also linking the civil society organizations and youth organization with the World Bank projects that are mostly country projects as well, and strengthening the link with that. Since then, we have actually started strengthening our country presence. GFF country-based liaison officers, now we've started recruiting them in a much longer term role. They sit within the World Bank office. At least we've completed the recruitment for 8 countries now. And one of their core mandate is to be that coordinating person that brings in government, civil society, and World Bank together. So that's been very focused in the mandate of their work as well. And we hope to see that, that improvement in terms of engagement with the bank projects as well. We have also taken the opportunity of the broader World Bank commitment to civil society and youth-led organization and more broader civic space support through the civic window that was set up by the World Bank in, I think, 2024, or it's getting implemented now in 2025, with very much core mandate of supporting grant-making, innovative grant-making to CSOs and youth-led organization and other civic actors on strengthening coalition building and capacity building, including knowledge transfer. I just heard so much examples from you all on the advocacy mechanism, so really facilitating knowledge transfer on mechanisms and capacities between countries. That's the other core focus of it. And the third one is really convening, which is focused around connecting these actors to financing platforms through the World Bank platforms that are better connected with the Ministry of Finance and other global health initiatives. We are, as GFF, we're partnering with the Civic as of last year, specifically in health area as well. And we are looking into a consortium-based model in specific 2 thematic areas. We're just starting to support that. One is on domestic resource mobilization, which is basically what you all have described right now, influencing the landscape of financing at the country level through civil society organization and youth-led organization. And the other thematic window is on adolescent health, which is also a very priority area and also a neglected area in some countries, because it's very difficult to group this category of people, and we often miss out funding for them, as Christina mentioned as well. So there's going to be a specific window for that. Calls for proposal are out, and I hope that the process will get finalized in the coming days to come. So the relative success of GFF in the last 10 years would have not been possible without the partnerships and the support from civil society organizations, both globally but also locally. But we also do acknowledge that there is so much learnings from our engagement, from the implementation of the model at the country level, and that we need to make sure that as funding situation changes at the countries, civil society and civic actors remain, because it threatens not only women's health in a way, but it also threatens the funding to civic actors, which are also very donor dependent, in terms of how to diversify sources of funding, how to work with government. I mean, Cornelia, you brought up a very good approach that you're not competing, but like really complementing, and you're a partner, not a watchdog with the government on fiscal accountability. And I like the framing and positioning on that too. It is more of a time where we all work together. I'll stop here and obviously respond to any question that you may have.
Thanks a lot. Your presentation helped me to share 2 examples of the work that has been done in Latin America, that we have done in Latin America in terms of domestic resource mobilization. For instance, when we discuss domestic resource mobilization, we talk about the cash the cash in the public sector, the one they use for buying and procuring medicines, other medical equipment, paying providers, all of that. Also, we talk about human resources, the nurses, doctors, everything that we need. But very importantly, we also talk about community resources. Because over and over, for hundreds of years, community always have their own resources with the time they give for education, collective action, mutual aid initiatives, such as for food security, child and elderly care. All of this is extremely important. So, and also, it is not, the purpose of mapping and counting community resources is not to say communities are fine, they don't need public service. No. Is for strategically to demonstrate that they also are an actor in this process. They're also putting the resources, and they must be an actor in decision making. So the whole idea is the processes, they should be part of the governance of the health system. So that's why many countries will do these exercises of mapping community resources, what they are doing that the healthcare service are not even aware of. We just published a couple of weeks ago the Lancet report with the World Bank on the resilience of primary healthcare in Latin America. And over there, we have a whole chapter about community resilience, community resources, and community participation in governance. So I would suggest, if you're interested in this, look at that report, because having strategies how to do this process, because it's extremely important for the governance of the system, okay? A second example that I want to give is one of the lessons of the COVID-19 pandemic was the importance of having regional hubs for vaccine production and strategic products. So that's very important. But usually this is discussed like something of international relation. This is just what the national, and to me that's directly related to domestic resource mobilization. Because without those hubs, countries are paying a lot more for strategic products. And the whole idea of these hub centers is that they are going to produce it regionally, and they will have lower prices. They will have also the chance of having the product quicker than having these other supplies. So to me, the lesson there is that we as a CSO, we should not see those processes like a separated. Yeah, this international. These are very much related to our goal of domestic resource mobilization. Whenever our national countries can acquire strategic products to a lower price with a more efficient system, it's always going to benefit the possibility of the available money, okay? And this is a very important lesson, because one of the ways that Latin America got away from that dependency of international funding for health, but also resources, was that from the 80s, when it was the most the policy reforms, neoliberal policy reforms, many of the countries built a coalition, regional coalition. For instance, the Central American country started a coalition of countries that could buy strategic products in international markets to make it cheaper. South America had like 2 or 3 different coalition of countries that could acquire strategic supplies. That's from the 80s, 90s. Since then, all these organizations still continue. And they are the ones that procure not only for health strategic, but they also do for education and some other strategic products for the country. So I would say that this step of going into regional hubs, that is still a discussion at national level, is into that direction, reducing the dependency on the countries, or in the diplomacy of strategic supplies that just give the vaccines to whoever we want to give, and having a more autonomous production of the country, and also controlling the decision-making within the region about these strategic products. So I would say that because of the relevance of these policies, we should see it, as I said in the introduction, in this broader sense. What other policies we as civil society can support, can become part of a coalition? That doesn't mean becoming an expert on everything. That means that we understand how relevant it is to mobilize resources and support those coalitions. In many cases, coalitions do not need everybody to be an expert in something. It just need to be talking in a unified voice, okay? And that's also very important. Again, it doesn't mean being an expert, just to understanding how important it is for this more collective goal, resource mobilization, and supporting all these different initiatives. Okay? Great. So with that, we're going to stop here the presentation, and we would like to hear from you. Over there in the back, please.
Thank you so much. My name is Elliot Olizara. Oh, it's off. Okay. Thank you so much. I'm Elliot Olizara. I work for Equitable Budgets for Women and Children, but I have been doing work around budget advocacy, but in relation to gender responsive budgeting. And I am happy that I listened to this. It's not a question, sort of, but it's like what we have done back in the country, and that has helped us. I think he mentioned it, something that it is very important to build the capacity of the citizens and from the local context, that the citizens can be able to speak towards their budget. Before, I think back in the country, in Uganda, majority of the citizens saw that organizations that really advocate for budgets are fighting government. And they saw talking about budgets and finance means you are talking about numbers, and it's going to be difficult for them. And I want to agree with Asimwe that one of the areas that is very important in budget advocacy is the issue of building capacity from the different area of concern. We have sort of like the budget plans and then the area of tax mobilization. But then you find that still when you talk about taxation, it becomes hard for different people to say, why should you talk about taxation? Taxation is supposed to be for Uganda Revenue Authority. So it is not necessary for you to talk about taxation. And then you find it becomes a very big issue. But I think, again, from the point of information, is like Uganda is one of the countries that through the Public Finance Management Act 2015, is when Uganda decided that to make sure that we follow where the money is coming from and how it is spent, it is very, very important for us to have what we call the gender certificate that really helps the different sectors and different departments to comply with what is happening, but then putting the eye of the gender responsiveness of the budget from the different areas. Let's say I will just give an example on the health sector budget advocacy and the rights. People thought that if there is a health center 3 in a certain constituency, it is okay not to have, let's say, family planning information and maybe having family planning, let's say, pills and condoms and what. But then civil society has tried to narrow that down and being helped with the Equal Opportunities Commission. And then this comes also to help us as civil society, and as what she says, the youth comes out to say, we are coming out to advocate for better budgets for the youth. And then the women human rights organizations also come to say we have to push for women concerns. And then the big question came to help the whole system of the government, that if people are coming down from the grassroots to advocate for better health, better budgets, and then knowing exactly that is a right for you to follow where the money is coming from and where it is being spent. So this helped a little bit in a way that the government started asking different organizing, let's say the youth coalition, the women coalitions, the different organizations that work at different levels in terms of sector working groups, to be able to say, okay, civil society, what do you want? If it is time for budget consultations, let's see exactly what you want us to plan for and where you want us to reallocate the money. And then different civil society working groups came in to give position papers. This is what we want in this region. And this is what we want for the for the persons with special needs. Where can the budget cutting across into the sectors, and for the case of health budget advocacy, different people need different types of support. It's not about the whole budget, but it's a budget that is going to cater for different people at different times and for different reasons without leaving anyone behind. Thank you so much.
Good afternoon. Thank you very much, moderator and panelists. By the way, my name is Abdul Karim Habib. Executive Director, Network Movement for Democracy and Human Rights, Sierra Leone. For us, health is an human rights issue, as also is a governance issues. Electing our leaders, we demand our rights constructively. And health financing is something in Sierra Leone, it is real thing on the agenda for Sierra Leone, how we health financing be sustainable. So we have a very big, ambitious idea that has been put on the table. We need maybe global level how we can able to start achieving that. We want to have law on health financing. When there is a law on health financing, you know, ECOSOS rights did not actually compel, you know, governance or government across the country to, you know, but if we have law, you know, it is actually compel political leader and also corporate institution how to support sustainable health financing, you know, because at the end of the day, you will see maybe today in Sierra Leone, there is a political will, but we are worried maybe the next government will not be a political will, you know. So if we have law on health finances, sustainable health financing, whatever governments come, you know, it will follow that. If you don't follow that, we'll take you to court because that's the law. It has to go through parliament. So we need, you know, global idea how we can do that, and we need support to make sure that's happen. If happen, it can be replicated in another part of the world. Yeah, but also Christiana talked something. It is like it's all over that our donor partner need to be more reasonable with us. A problem has been there more than 200 years. You give me $70,000. You want an impact immediately. So that quick impact also, we want our donor partner to be reasonable to us so that we can able to, because it's a social change. It happens gradually. It's not just happen a day because people, the stereotype are used to that. You have to move them gradually. So how do we as a global leader work together, teamwork to make sure that this thing happen? Because for us, we are a Gavi partner, and Gavi is always in by 2035, we are moving out of Sierra Leone. How is that going to be sustainable? I need your answer.
Hi, everyone. Erin McConnell from Treatment Action Group, or TAG. Mustafa, I really appreciated your point about how alienated the global health community has been from a lot of the financing conversations because we have benefited from the past quarter century. But you know, I at TAG have been involved in the financing for development conversations much earlier than Sevilla, and I was frustrated I was both hopeful and frustrated seeing that health groups were engaging in financing for development, but only in Spain and not really in the lead up to. And in those conversations, we're actually operating in opposition to some of the development groups that paved the path forward, and we're doing a lot of the CSO engagement at the UN in April and for the past decades. And so I have like a kind of a two-part question, and I will try and keep it brief. The first is, how do we meaningfully capacitate existing health CSOs to join the larger conversation that development groups, climate groups, education groups have already paved the path forward for and have done ample research? And then how do we ensure that we're moving collaboratively with these other sectors? And an example of why I think that's a huge issue is that many of the health actors that I work with are pushing for debt swaps, which I know you mentioned, which, full disclosure, I'm against. But the development and climate allies are actually, like me, very against these, and they have ample research as to why they haven't been effective in these other fields. And that's not to say that they can't be effective in health, but I think it is concerning that we're not necessarily talking with them and advocating with them and figuring out a path forward. So kind of collective question, you know, we are so behind in the health sector as far as operating in this space, figuring out how to suddenly get resources that we've been very lucky to have through USAID, PEPFAR. And we're also incredibly well-resourced to make the case from the community level for a lot of these innovations. How do we work with other sectors to make that collective case and a vision that prioritizes human rights, including health, and navigate those together without, pushing our allies to the side. That's all.
Thank you so much, and thank you all the speakers for your great insights. So, Mustafa, you talked about these are unusual times. I'm trying to make sure that I quote you correctly. And then Christina reminded us about accountability and how that matters now more than ever. And Cornelia, hi Cornelia. You talked about progress we've made translating commitments to action over the years. And then Diwa reminded us about the fiscal space and that the fact that in many countries now it's really not ideal. So I just wanted to hear your reflections on what can we do differently, given that governments are fiscally constrained and civil society is underfunded. I feel like sometimes we can be a little bit, one could argue that we're being a little bit tone deaf, expecting countries to do the things that we're asking them to do a few years back before the craziness. And then someone was talking about how intense the civil society work is on an annual basis to follow the money and do the accountability work. So with less funding, what is it that we can do differently? Just wanted to hear your reflections on that. Thank you so much.
Hi, my name is Jeannette Kalegil from Disability Inclusive Development Programs. I learned a lot today from the youth program as well as the information on health. But I haven't heard anything about how people with disabilities are included in your program. And as you know, they are the most excluded groups. So, any information about it?
Great. So I think we have enough questions. If you want to try to answer, you can pick any of the questions if you think you have answers to any of the questions. There were three concrete questions. Who wants to go first?
Okay, I'll jump in. I didn't quite get your name, but I think you were asking regarding what are the next steps right now with everything that we're facing. How do we do things differently, and how do we sustain successes? It might not be an exact answer, but as someone who has been working on the ground and what I have seen, that I think as all of us in here can do differently when we go back, is how we can harmonize our skills, our products, right, as civil society. I see that we can be civil society in the same group. Maybe we're working on reproductive maternal newborn health. We'll find that this coalition or civil society organization that maybe has enough funding and enough presence has developed a scorecard or has developed some strategy. Now that strategy on the ground will be considered as for their coalition, the work that they do. And then you'll find another civil society receiving money instead of building on what that organization has done and say, okay, we're going to pick up this model and implement it with the funding that we have. They'll develop their own. And so we are seeing money coming in, and when we count for the money, we'll say, okay, civil society have received this much. But you'll find more than 50% of that money has done the same thing. So there's no results on the ground. And so I think one thing we can do as civil society is to put our jackets on the side of what we represent on the ground and realize that, as Mustafa said, we are in crisis. And so we cannot afford to be segregated and to look at each other as, oh, this one is receiving funding from Gavi. This is receiving funding from PAI. This one is receiving funding, so we're not going to talk to each other. We cannot operate like that anymore. So moving forward, I think we need to look at our systems and areas we're working in and see who has done what and where can we work together, put our differences aside and say this is the time that we need to build from what other people have done. And that's the only way we can be effective with the resources that we have as they're dwindling. But it can be effective in terms of like making impact on the ground. So that is one way I think I would respond to that. I can give an example, and as you were talking, it came back to me about expenditure tracking. So in Malawi, with the youth-led organization, and I think funding that we had managed to get from PAI, we managed to train youth leaders on expenditure tracking. And so we got this funding for 2 years. And so the first phase was training youth leaders from subnational level. So we would train them to understand expenditure tracking. Sexual reproductive health rights budget tracking was our focus. And what we were doing was we were not working in silos with the government. So we would work with technical working groups on youth, technical working groups on sexual reproductive health rights. And we would work with youth policy officers that are placed on the ground to give us a team of youth leaders that they've seen have potential but lack capacity to effectively engage in those platforms. And that's what we had done, I think, the first phase of the project. Then we scaled it up to actually training youth leaders that are more influential on a national team, which I think is a great example that we can replicate, because it was the first time ever in Malawi that you'd have a coalition of youth leaders across the globe, be it they're working on HIV and AIDS, they're working on malaria, they're working on this. As long as they're doing health, we came together and said, okay, so what can we look at very well together, collectively, that when we go and speak, we're speaking the same language. And we came up with a position paper for that. And I think that was very impactful. But again, how do we scale up these good products that we have moving forward? How do we make sure that really there's that sustainability moving forward? And I guess those are some of the conversations that we can have. I think I'll pick it up from there and let my colleagues follow.
Great, thanks. Erin, you asked some really hard questions, okay? And I don't think they're simple solutions. But first, I just want to say a shout out for Treatment Action Group. Without you, we won't be where we are with the HIV epidemic response, okay? So I just want to, and I think there's a key point there that I'm trying to make, and I know my colleagues and I also know that we have to work in concert with governments as well, but we also have to be noisy, okay? And I mean it in a good way. If Treatment Action Group had not been as noisy as it was in the 90s, we would not have the solutions. Amanda and I sometimes talk about this, the number of funerals we attended in the 90s because there was no response to HIV. And so I think it's important to keep remembering that as part of civil society, yes, we're there as partners with government, but we're also there to remind them of what their priorities need to be, ought to be, and should be, right? I think on the second question, I have to say, I don't have an answer. I think we need to have a stronger dialogue amongst health organizations about how we fit within the larger development architecture. We've not really had that conversation. Health organizations tend to talk about health without contextualizing it within a larger development conversation. We need to do that. I can promise that we, as an organization, as people, will approach this with humility and with an aspect of there's a lot we need to learn. I have been blown away. I've signed up for and engaged on the pre and post financing for development groups, and I am blown away by how organized the groups are, how coordinated the messaging is, how collaborative the groups are. And part of me, Erin, is saying now how do we bring this to the health sector? And how do we learn from this really effective ways? Nabia will tell you as well that she and I have been talking about how do we bring this so that we can have one effective voice across so many different voices. But I think it's going to take a fair bit of humility. We were extremely, extremely well funded for good reason. And with that, we didn't have the humility that the others developed over scarcer times as well. And I'd love to separately have a conversation with you about debt swaps so I understand better the why of why you're so concerned and what's wrong with it. We need to learn that as well. Manda, you had a question about accountability. What do we do differently? Cornelia, I don't know if you want to take that on, and the question that Manda had around that.
Thank you. So to what can we do differently? I think we need to work with the little that we have as is, because the minute we're able to understand where the little money that is coming in is going, how it is being used, to what end, then we're able to have that tangibility to actually know that this is how much more we need to be able to move. And we have seen it in the family planning space, but now it is time that we need to scale that into the other spheres as well. And when we talk about the integration and how to work with the other sectors, it is still the same thing. It comes down to, if it is 1 million and government is giving us that 1 million, where is that 1 million shillings going? If it is going to the commodities, which commodities are these? Which ones do we need? And that smallness, we're able to, one, appreciate what is already coming in. We're able to also know that when we look against the need that we have, which I think most times we tend to forget, yet it is, and even in the policies that we develop, we sometimes forget that, is that once we're able to correlate these, then it becomes easier for us to then use the economists to help us do the modeling of how much more then can we be able to advocate for and be able to ask for. I think the other is that we know that some of the countries, some of the governments have access to information strategies, which we hardly use when we're talking about budget advocacy. And I think it is high time that we take a moment to sit back and reflect on what this actually means and how we can be able to position the messages that we want to have, that we're asking of government from that mindset. Thank you.
Yeah, I just want to give a brief response to some of the questions. I think definitely we need to see ourselves differently than just in our specific area expertise, but seeing ourselves in the broader challenge of development and humanity. For instance, the approach of planetary health. How do we fit within planetary health? For instance, at this moment, there's a very active civil society with national governments pushing within the climate change discussions about compensations. Compensations to countries being affected by those countries that have contributed the most to climate change. So many of our countries are being destroyed at this moment because of the extreme weather events. But at this moment, a lot of the discussion is destruction of infrastructure. Buildings, school roads. So we can contribute to the discussion saying it's not only infrastructure, it's also all the public services that have been lost because of those buildings not being there, because of the road not being there. And that means people dying, people being affected. So we could get into these efforts and saying, if we are going to rebuild, if this compensation works, we're not only building exactly the same. Why don't we start rebuilding, thinking about infrastructure that is resilient to the new times, but also take into account compensation for those communities that were mostly affected by the loss of public services, taking that into account, and not only thinking about infrastructure. So that's something that all of us within it can contribute to that major movement, which is getting more and more gain, and probably a lot of the domestic resource mobilization may come from there. I don't know if you want to say anything.
Yep, just a few quick reflection as well. Perhaps I'll start with your question in terms of fiscal space issue in countries and how do we continue to prioritize support for health. One thing that Mustafa, you mentioned it a bit earlier in your intervention as well, is the question of efficiencies within health system. If you look into budget execution, in many low-income countries, you will see that it's between 70 to 85%. It means 20% of the allocated budget within governments, they don't end up getting used. And it's not because the country doesn't need it. There is so much need at the country level. It's just because of budget rigidities at times that, you know, you cannot move things in between. Midterm reviews by the Ministries of Finance are rigid. So that reallocation process and also inefficiencies within budget is somewhere that we can jointly advocate for to target more support for health program broadly, but also for women, children, and adolescent health. And more specifically, we spoke as we started the discussion on broader taxation reforms, fiscal reforms that countries are undertaking. and to address debt crisis at the country level, but also to strengthen their fiscal position. And that's very much needed. But what's important specifically when it comes to financing women, children, and adolescent health, to me, that's not only, it doesn't need more money, it requires prioritization. We don't need to vertically finance these. We have seen in countries that integrated primary health care, where these interventions that are highly cost-effective, that are scalable, in different countries, in less than $10 per capita, they have been able to yield results. So how can we really look into those models, and specifically with the primary healthcare lens, in bringing those evidence to government continuously, that it's not a matter of increasing the pie or the fiscal space, but it's a matter of prioritization too. In the budgets, you see, for example, budget lines for creation of new hospitals that end up not getting one, but then you don't see budget for critical RMNCH or reproductive health programs. So it's a matter of trade-offs too. So those tools and evidence that you showcased earlier, these can be very helpful in helping governments do make those trade-offs. And I think those trade-offs are being made everywhere. And I think one other reflection from colleague Abdul Karim, you brought up something very interesting as well on sustainable health financing. And I really like the point, how do we keep the political momentum? Governments shift. What's the strategy and what's helpful? That is an issue across countries. But to Cornelia's point earlier, and also Christina, to your point, it's important that we focus on the successful design of health programs, and champions, while they should be politicians, but I think there must be institutional support for it as well. Leaders are not only ministers of health who keep changing, and every 4 years they could be strong civil societies at the country level, a stronger technical people at the Ministry of Health who will preserve the gains that are made. And what's helpful is the benchmarks of like really using data to see what's the government expenditure on health and how does it compare with other sectors, with benchmarks that are set under Abuja, different ways to continuously advocate for that. And to your point on transitions from global health initiatives, you brought up a point on Gavi and others. I think that discussion on transition doesn't need to start in 2035. It should start today. And the programs that are being made by everybody, they need to get integrated within country health system. And that transition doesn't need to be abrupt. That's the major learning that we're learning today as well, that they need to be pre-planned, and integration is the best way forward for that. And I also want to acknowledge some very good points that were made from Uganda on how the government has been able to bring civil society together and co-create an accountability plan. I think it's such a good best practice with PFM system being able to track that I would love to learn more about. Thank you.
Great. So we reached our time. So thanks to the audience. Thanks for the great questions. And thanks to our panelists. And see you next time.